Hi, my name is Sarah, and I am in the NP program through Cal Baptist University, and I will be discussing the generational health disparities for the Hernandez family that is out of Santa Ana, California. So, the questions that I chose to focus on for this assignment, the first question would be the clinical medical. How should care models adapt for underserved multi-generational families? And as an RN, I think that, we are really focused and trained to look at the whole patient and the whole person, not just the one situation at hand. And the issue here is the whole family. And the whole family has issues with health, with diet choices. And some things that we can do as healthcare providers is to take a look at the whole family as a whole and to be mindful of the cultural based practices that they use. So this isn't just about what medications do they need to take, but it's also about what do they use to implement in their daily care. Also, as a healthcare professional, we can utilize mobile health clinics. We really could focus on education, healthy diet choices, things like that, that can help them to make better choices for themselves, may even help the grandmother with some of her diabetic issues. One of the other questions that is provided is faith integration. How can faith-based communities support long-term wellness? In the Hispanic culture, there's a lot of church activity and involvement amongst family members. So the churches can get involved with hosting mobile clinics. They can have mental health outreach programs. A lot of churches offer food bank opportunities, with healthy food choices. They can bring in a factor of trust that is going to be essential for these families. They feel that they can turn to their pastors and their church members and receive opinions that they trust in and would look back on. Another question that is asked is interdisciplinary collaboration. How does teamwork improve community outcomes? And this is so vital. It is going to take part of everybody's to make a difference and an impact in these different communities. We need social work help who is going to help with affordable housing, access to affordable transportation. Transportation is a big problem as far as hindering people from being able to reach doctor's appointments, healthy food resources, things like that. So social work is has a huge impact in those areas. Then, of course, we have our medical professionals, our MDs, our PAs, our NPs, and our RNs who can help with mobile health clinics, bringing in bilingual providers to help with the language barrier, or having the translation devices available to also help with language barriers. We have behavioral health specialists who can be present to help with mental health issues, and dietary specialties who can come in and really educate these people in this family on the different nutrition choices that they're making that have a direct impact on their health. I hope that does answer some of the questions that we were asked to provide. Thank you so much.